Morning to you, it's 8:13. You know what? May is Mental Health Awareness Month, and Indianapolis Public Schools works all year long to address mental health among students, staff, and teachers. A little more emphasis telling us what you do specifically throughout the year in May. It's just appropriate timing for that. Joining us here to talk about this is Dr. Christy Eaton, IPS Wellness Specialist, and Arlington Wood School Principal Taisha Henderson. So thank you, ladies, for being with us.
Thank you.
Unfortunately, emotions are still very fresh over what happened Friday in Santa Fe, the school shooting there that killed 10 people, 2 teachers, 8 students, and another school shooting, another accused shooter with ties to mental health issues. This is something that you're both very familiar with. At times like this, what does it remind you of the importance of connecting with your students and tracking mental health?
I think that's an excellent question, and one of the things that we really look at and feel like is really important is to arm our teachers with the knowledge and ability to be able to recognize those students that need support and that may be struggling with mental health challenges, and not only just to be able to identify those students, but then take the next step. What do I do next? Refer them to social workers and school counselors and school psychologists and mental health services, so that those students who are at risk get the support that they need, hoping to mitigate or prevent something like this tragedy from happening.
And it's so interesting. I mean, there are layers of this. It's kind of a 2-part plan that you have. You have the first kind of, here's what we offer if you're struggling and you need someone to talk to. For instance, you reach out to your high school students saying, we're here for you. What do they do? What do they come to talk to the counselors about?
So we allow them to express themselves during community circles every day. So every teacher hosts a 20-minute community circle where they can talk about their feelings, they can talk about their experiences, they can share amongst their peers what they're experiencing. And through these conversations, we're able to provide our students with an in-depth awareness of themselves and what goes on around them.
And that could be a way to possibly pinpoint a student that might be really struggling with some demons.
Absolutely, absolutely.
And so how does that second part come into play? Now we're talking about the Review 360 program. So talk a little bit about that program. What is it and how does it work?
One of the things we wanted to do in our district is really be intentional about identifying students that were at risk. And so we did a lot of research and identified this program, Review 360, that offers a universal behavioral health screening for all of our students. We piloted it at Ms. Henderson's school, Arlington Wood, School 99. So we were able to identify kids at risk, and not only that, this tool also offers us the ability to provide research-based interventions that teachers can use to help students progress, and then also it offers a progress monitoring tool so we can keep track of how students are doing. And our first year, this is our first year, we're just finishing up and we're starting to look at the data we've collected over the course of the year. And we're super excited because we had a number of kids in the high risk category. Wow. And we had 39 kids drop from high risk to low risk.
That's amazing.
Yes, with just those research-based interventions that those teachers were able to be put in place in their classrooms.
And I have to ask you, I'm sure you know some of these students.
Definitely.
Did you see the visible change in them?
Yes, we saw them reaching out for help, for one. They were able to communicate not just in words, but through sensations, how they were feeling. And that was a plus for our students. Normally, they do not communicate at all what they're feeling.
They're teenagers.
Well, they're elementary students.
Elementary,
yes.
You know, it's just this,
yeah.
It's not easy to learn that.
And so just being able to communicate is a big win for our students.
Okay, Principal Henderson, Dr. Eaton, thank you so much for being with us this morning.
You're most welcome.
And we're going to post much more about this online at wishtv.com.
Thank you so much.